Social policy is all about how governments try to improve society and the lives of individuals. These are the actions, plans, and laws put in place to tackle important issues like poverty, education, health, unemployment, and crime. In simple terms, social policy is how governments try to make life better and fairer for their citizens. But social policies aren't one size fits all. They vary depending on the needs of the population, political values, and wider social changes. Some policies focus on supporting people through difficult times, while others aim to prevent problems before they start. We can break social policies down into a few key areas. Welfare policies aim to support individuals and families who are facing hardship. For instance, Universal Credit in the UK provides financial support to people on low incomes or those who are unemployed. Health policies are designed to protect public health and ensure access to services. Examples include the NHS Long-Term Plan, which addresses mental health services and waiting times. Education policies work toward making learning more equal and accessible. Initiatives like the Pupil Premium aim to close the achievement gap for disadvantaged students. Family policies support household life and parenting. For example, shared parental leave and childcare subsidies help working parents balance employment and family duties. Lastly, crime and justice policies focus on maintaining safety and order, such as community policing strategies or efforts to reduce reoffending through rehabilitation programs in prisons. Overall, social policies reflect the values and priorities of the society they are created in and often change depending on the political party in power or public opinion. Social policies are not just practical tools for managing society, they also provide sociologists with crucial insight into how society functions. Through social policy, sociologists can explore how society regulates itself, such as by introducing laws and welfare systems to manage behavior and support people in need. These policies also show how society maintains stability by ensuring everyone has access to basic rights and services like healthcare, education, and housing. Finally, they demonstrate how society supports its members, especially the most vulnerable, such as the elderly, disabled, or unemployed. Understanding these elements helps sociologists assess how fair and effective our social structures really are. Before we explore the different sociological views on social policy, it's important to understand that not all sociologists agree on the purpose or effect of these policies. Each perspective brings its own ideas about whether the state should intervene in people's lives and whether social policy helps to create a fairer society or simply reinforces inequality. Functionalists see social policy as a positive tool used by the state to keep society running smoothly. They believe that policies like those supporting education, health, and welfare contribute to the stability and integration of society. For example, providing equal opportunities in schools helps ensure social cohesion and fairness. Functionalists argue that sociologists should focus on identifying what works well in society and support evidence-based policy to improve it further. In contrast, the new right approach is much more skeptical about the state's role in people's lives. They argue that too much government support creates dependency and weakens personal responsibility. Instead of relying on welfare, individuals should be encouraged to take care of themselves and their families. This view became especially influential in the UK during the 1980s, when policies were introduced to reduce state spending and promote free market solutions. Moving further left, Marxists offer a more critical take. They argue that social policy serves to maintain the power of the ruling class by keeping workers healthy and productive without challenging the inequalities of capitalism. Welfare support, in their view, is not about helping the poor, but about preventing unrest. Policies that seem to promote fairness are, according to Marxists, just a way of creating an illusion of equality. They believe that true change can only come through revolutionary transformation of the capitalist system. While Marxists focus on class inequality, feminists highlight gender inequality. They argue that many social policies reflect patriarchal values and fail to support women fairly. For example, traditional family policies often assume women will take on caring roles. However, feminist campaigning has led to some important policy changes, such as equal pay legislation and better protection against discrimination. Most of these gains reflect liberal feminist ideas, aiming to create equality within the existing system rather than transform it completely, as radical feminists would prefer. Finally, postmodernists bring a very different angle. They suggest that traditional social policies may no longer be effective in today's complex and globalized world. People's identities, experiences, and needs are so diverse that a one-size-fits-all approach doesn't work. Instead of focusing on state-driven solutions, postmodernists look at how individuals and communities can shape their own futures through choice and diversity. Sociology can have a strong influence on social policy, but this influence depends on a number of key factors. One major consideration is electoral popularity. Governments are often reluctant to adopt policies based on sociological research if those ideas are unpopular with the public or risk losing votes. For instance, proposals to increase support for refugees or introduce higher taxes to fund welfare may be evidence-based but politically risky. Another important factor is ideology and policy preferences. If sociological findings align with the beliefs of the party in power, they are more likely to be taken seriously. A good example of this was during the 1980s, when the Conservative government under Margaret Thatcher embraced new right ideas. Research that promoted free markets and individual responsibility had more influence than research supporting state intervention. Cost and funding also matter. Even when sociological research recommends effective policies, governments may ignore them if they are too expensive. For example, expanding mental health services or providing universal childcare may be widely supported by sociologists, but are difficult to implement due to budget constraints. The role of globalization cannot be overlooked either. In today's interconnected world, international organizations such as the International Monetary Fund and World Bank can shape the social policies of national governments, especially in lower income countries. This limits the power of domestic sociologists to influence their own government's decisions. Finally, critical sociology, especially perspectives like Marxism, can struggle to gain traction because it challenges the foundations of the current political and economic system. Governments may be less inclined to act on research that calls for radical structural change, even if it highlights serious social inequalities. In summary, while sociology offers valuable insights that can help shape fairer and more effective policies, its influence depends heavily on political will, economic feasibility, global pressures, and whether the research aligns with mainstream ideologies. When we zoom in on the family, We see how social policy influences the way families are supported, structured, and expected to behave. From rules around who can marry to how much help parents get with childcare, social policy shapes family life in powerful ways. When it comes to families, we often see two main types of social policy. First, there are policies that provide material support. These include things like child benefits and tax credits, which are designed to help families manage financially, especially those on lower incomes. For example, working tax credit was introduced to support working parents with low earnings, helping them afford necessities like food and housing. Second, there are policies aimed at helping families balance working life and parenting. These include things like maternity and paternity leave, flexible working laws, and access to affordable childcare. For instance, shared parental leave introduced in 2015 allowed parents to divide up to 50 weeks of leave between them, which supported more equal parenting roles and challenged traditional gender expectations. It's useful to examine how social policies have changed over time to see how they have impacted the family. During the 1980s and 90s, under conservative governments, many policies reflected new right values. The aim was to reinforce the nuclear family and reduce welfare dependency. This era saw the introduction of things like the Child Support Agency, the Children's Act 1989, and the controversial Section 28, which banned the promotion of homosexuality in schools. Policies like the Married Men's Tax Allowance further reinforced traditional gender roles. Then from 1997 to 2010, the new Labour governments took a slightly different approach. They were more open to diverse family structures, but still encouraged responsibility and work. Sociologists Silver and Smart noted how these policies supported dual earner families while still valuing traditional forms. Examples include longer maternity leave, parenting orders, and working families tax credits. Civil partnerships and anti-discrimination laws also recognized growing diversity in modern families. After 2010, things became more mixed. The coalition government brought together MPs with very different views, some supporting family diversity, others holding on to traditional ideals. As a result, policies were often inconsistent. Still, there were important developments like shared parental leave and the Equal Marriage Act, showing a shift toward recognizing equality and diversity in family life. Between 2016 and 2024, the Conservative government introduced a mix of family policies shaped by ongoing debates around welfare, work, and personal responsibility. Policies largely focused on encouraging employment and reducing welfare dependency, with continued support for universal credit, a system that aimed to simplify benefits but faced criticism for delays and hardship, particularly for single-parent and low-income families. During this period, the government also promoted traditional family values through tax incentives for married couples and limited increases in child benefit. However, the COVID-19 pandemic, 2020 to 2021, brought significant disruption and led to short-term shifts in policy. Emergency support measures, such as the furlough scheme, increased universal credit payments, and free school meal vouchers during school closures were introduced to protect vulnerable families. These interventions temporarily expanded the role of the state in family support, but many were rolled back as restrictions eased. The pandemic highlighted inequalities in access to housing, childcare, and digital learning, and raised long-term questions about how well family policies address the realities of modern, diverse households. Beyond party politics, several landmark policies have had a long-lasting impact on family life in Britain by reshaping roles, responsibilities, and family structures. One of the most important was the 1942 Beveridge Report, which led to the creation of the welfare state. It introduced services like the NHS, national insurance, and housing support, shifting many caregiving responsibilities, such as healthcare and support for the elderly, from the family to the state. This particularly benefited working class families and reduced the domestic burden traditionally placed on women. The 1969 Divorce Reform Act also marked a turning point. It allowed couples to divorce due to the irretrievable breakdown of a marriage without needing to prove fault such as adultery or abuse. This made it easier for women to leave unhappy marriages, increased family diversity, and promoted greater independence for individuals, especially women. Similarly, the legalization of the contraceptive pill in 1967, especially for unmarried women, gave women control over their reproductive choices. This led to changes in family planning, delayed childbirth, and a decline in birth rates as more women pursued education and careers before starting families. Together, these policies didn't just provide support, they helped redefine what families look like, how roles within them are distributed, and how responsibilities are shared between the home and the state. But how these policies are viewed and the intentions behind them can vary depending on your perspective. Sociologists offer different ways to understand the impact. From a functionalist perspective, social policies are generally seen as positive. Thinkers like Ronald Fletcher argue that health, education, and housing policies support families in performing their roles, like raising children and maintaining stability. In this view, government support contributes to the smooth functioning of society. On the other hand, new right thinkers take a more critical view. They idealize the traditional heterosexual nuclear family and believe that this type of family is self-sufficient. In their eyes, policies that support lone parents or non-traditional family forms can undermine personal responsibility and even threaten social cohesion. For example, welfare policies are often criticized for encouraging dependency. Feminists, meanwhile, draw attention to how policies often reinforce traditional gender roles. Many are based on the assumption of a patriarchal family model, with a male breadwinner and female carer. Even when policies seem supportive, like childcare subsidies, they often leave women continuing to shoulder most of the unpaid domestic work. Feminists argue that policies need to be more conscious of gender equality within the home. Then there's the Marxist perspective, which takes a more structural view. Marxists argue that family policies are designed to serve capitalism. By promoting the nuclear family, the state encourages a stable unit that helps reproduce the workforce and socializes children into capitalist norms. So, from this angle, policies don't just help families, they help maintain class inequality. So, in the big picture, social policy isn't just about giving support. It actively shapes the way families are formed, how they function, and how they evolve. It influences who does what within the home, who gets recognized and supported by the state, and which family structures are seen as the norm. Whether it's promoting traditional nuclear families, responding to growing diversity, or adapting to new social challenges like the COVID-19 pandemic, policy plays a central role in defining what family life looks like today. As society continues to change, with shifting gender roles, economic pressures, and more inclusive attitudes toward relationships, family policies will need to evolve too. Understanding the impact of past and present policies helps us ask important questions about the kind of families we want to support in the future, and whether our current systems are truly meeting the needs of everyone.